Do you have years of chronic migraines which aren't responding to medication? So we have a comment here saying that this person has had, unfortunately, years of chronic headaches, migraines, severe neck pain and shoulder pain. They've already had some scans, they've been prescribed medication, but even then they haven't been referred to any other further specialists. And unfortunately, this is something that we do see quite commonly. And I get it to some extent because seeing a specialist, in most cases, it's going to be something that's going to be life-threatening or should be dangerous, because that is really where medical doctors shine the most, when something is life-threatening, where it's very, very dangerous. However, for a lot of doctors, they may look at someone, unfortunately, who has neck issues, shoulder issues, headaches, migraines, and depending on them, they may not take it as seriously, and they may not look to give either a referral or to do further testing. So even here, this person has mentioned testing. I honestly don't know what kind of tests or scans they've had. I don't know if it's CTs, MRIs, nerve scans, X-rays, exactly what they've gone for. But unfortunately, this is something we do hear quite a lot from people. And there is this kind of mix of things where a doctor may look and say, oh, they have neck pain, so they go see one type of person, like say, see an ortho. They have migraines, maybe they go see a neurologist, but they don't usually mix the things together quite as commonly as would be expected. And if they did, of course, then they may start to suspect other things are going on for them. So here in the practice, I specialize in neck issues. I'm an upper cervical chiropractor here at Vitality Chiropractic. And what we see every single day with our patients is this combination of symptoms. That is the most common thing we see. It's not usually that someone has just one thing. It does happen, but it's not quite as common. What's very common is there to be this combination of things going on, like neck issues, shoulder issues, headaches, maybe dizziness, maybe digestive issues, maybe effects on their mood, maybe feeling a bit more anxious, maybe having brain fog. All of these things very commonly come together. And the reason for this is because the area that we focus on is what's happening here at the top part of the neck. At the top part of the neck, that's where we have the top parts of the spinal cord, and just above that is the brainstem. So the brainstem will be just kind of inside the skull, just behind here. However, of course, like if I had a rope and I pulled on the bottom part of the rope, it's going to start to affect further up. And the same thing will happen here. So if something is happening at that top level, it can start to affect the nerves which are going through in that spinal cord, as well as the upper part, which is the brainstem. And this whole area, this combination of the brainstem, the upper spinal cord, all of this sends all of the information to parts of your head, your eyes, your ears, your face, your neck. And then it starts to affect things down to the shoulders, the arm, the hand, and the fingers. So it makes perfect sense that if something is happening at this level, like we examine here in our practice, they can start to affect this array of symptoms. And that can be why sometimes things like, say, medication are not as effective. It doesn't mean that medication is not a good thing, and in some cases it's not completely needed. But if someone has a pain system going on in their body, and they keep having this message that says there has to be pain, it must be painful in this area, just trying to turn that off with medication is not always going to be very helpful. However, if there's something like we can see here, where there's something physical, effective